Hey guys, my setup is a little awkward right now because I'm too lazy to go downstairs and grab my desk tripod. So excuse your girl. But anywho, just wanted to do a quick video updating you guys on my progress. But before I get started, as always, I just want to thank you guys who have already liked, subscribed, commented, and shared, or reached out to me via email at always.nigeria@gmail.com. I just thank you guys for following my journey. I love when you guys interact with me. I love when you guys email me. With that being said, those of you who are new to my channel, I appreciate you for coming. Or whether you find this video helpful or not, I still appreciate you clicking on my thumbnail. So thank you, and I hope that you do find this video enjoyable and you go ahead and like, subscribe, and share, and join the family as well. So without further ado, your girl is in clinicals, y'all. Yes, I've been in school for 8 weeks now, and I'm already in clinicals. I passed my first. Y'all gotta excuse me. I'm getting ready for clinicals. I passed my first 2 skills labs, which was fundamentals and physical assessment, and I passed the classes, which was fundamentals and physical assessment theories, lecture, whatever you call them. Anywho, so I passed both classes with B's, which I was surprised about, but I thank the God for, because I wasn't sure, because nursing school is really hard, you guys. It's very time consuming. So I was actually just studying, but I looked at the time and it's like time for me to get up out of here. So I actually have like an hour and a half, but I try and leave early so that I can, account for any traffic that I may run into or anything like that. Any detours, anything. So I can stop and grab something to eat and all of that good stuff, because I'm in clinicals until 10:30 at night. And it's 1 right now, so yeah. I try to account for anything. I try to leave out early. Y'all can see your girl can't wear much makeup. My hair is in a messy bun. Tired of the bun look, but I'm more tired of the backwards bun look, the bun straight to the back. So decided to do a quick little messy bun. I had braids in underneath a wig, which I'm gonna throw back in this weekend because I'm tired of the bun, but I don't want to flatter on my dang on hair because it's pointless when I'm gonna have to turn right back around and put it back in a bun. So anywho, clinicals, I can't give you guys too much detail like as far as patients, but my clinical site is very small. It's a hospital. You'd be surprised that it's a hospital, but it is a hospital in a small city. But luckily the floor that I'm on is going to be moving to the first floor. So it's med surg, so you guys know that I'm, dealing with patients either who need surgery or who've, just had surgery or whatever. And so clinical is a little different than I expected. I didn't think that, you would be responsible for everything. I thought more along the lines of, you'd be kind of trailing somebody, but actually clinical is more so about you being the nurse. You go in, you get report from an actual nurse or whoever is taking care of the patient, which is the nurse. They give you a report, then they excuse that blanket back there, but I don't have a blind up and it'd be too sunny. Anywho, they give you a report, then you find out who your patient care technician and your nursing assistant is, and you talk to them and you let them know, based off you look at it in the chart or based off what you just got from report, if it's time for the patient to get like vitals or anything like that. And if you have the time, you can do it yourself, but if you don't, then you can have your team, which is going to be your nurse assistant and your patient care tech, or I don't know if your hospital or your clinical site has both like mine, but if they do, then you'll have one of each. If not, then you'll have one or the other. Anywho, you get your report, you go in, you introduce yourself to your patient or patients, and you go from there. Once you introduce yourself, you leave back out. You go, of course, look in your patient's chart and things like that. It's best, like in my opinion, to introduce yourself before going through their chart, because you don't want to have to go in the room and just start doing stuff on them. You know, you already want them to have an idea who you are and things like that. If I walk in your room with a whole bunch of medications, for example, or I just come in and start doing stuff, you're gonna be like, girl, who is you? I don't want to come in there with all that stuff. That's a little intimidating, especially because the patient doesn't know who you are. So it's best to always, you know, go ahead and introduce yourself. Ask them, is there anything that they need right away? Like things for comfort, such as like water or anything like that. And then you can leave out and go ahead and get yourself prepared by looking into their chart, checking their meds and things like that. And then going back in there once you realize, you know, like, okay, it's time for this medication or, you know, things like that. You have to do your assessments before you can even start giving meds. So you want to go in there because you've already introduced yourself. Now they know who you are. So they know when you come in there, you know, your role. And your role is a student nurse. But at that point, your role is the nurse. You're just practicing under a registered nurses or nurse practitioners or whatever your clinical instructor is. It could be a doctor. So whatever that person is, you're practicing under their license. And so you go in there, you do your assessment and things like that, and then you take it from there. So that's fun because you get to look, like I said, look in their charts, and you can kind of, after being in class, see that the things that you're learning in lecture are actually correlating over to the things that you're going to be dealing with once you get to clinical. So like, you know, going in there, you can look at some of their labs and be like, oh, okay, this patient may have X, Y, and Z. So like I noticed that a few of my patients had like higher white blood cell counts. So I knew that they probably had an infection, which they did. And things like that. So you can kind of start paying attention to that. You can kind of start noticing the different medications that they're using and what those meds go for and what they're possibly treating and things like that. And then, of course, it's not all fun and games. So it's not just all hands-on. You have to do, you know, case studies or not case studies. You have to do care plans and nursing interventions, which are a part of your care plans. And you have to reconcile medications and things like that. And before you actually administer a medication, you have to know what that medication is for, what the adverse effects are for, what the safe dosage range is, what your patient's range is, why they're taking it, the frequency in which they're taking it, who prescribed it, things like that. You have to know that before you give any of those meds. So for me personally, I go on my patient's chart because they try to give you patients that they know won't be discharged, the next day, so that you can have the patient for at least 2 days. So I've had patients for 2 days, and I'll go home and I'll look up what their medications are and things like that. And then I'll be able to know why they're taking it and all that good stuff. So because that's actually part of your homework, you have, for my school, you have to fill out 5 medication charts, and those are the questions like why they're taking it, what the safe dosage is, what the nursing interventions will be, what are the adverse effects, and things like that. So it's actually very helpful for me to write down all their meds, because when I'm there, of course, I have to look up the meds while I'm there on the computer or in my medication handbook or something like that. And so while I'm there, that's what I do. But I typically write down all their meds so that when I come home, I can just look them up and I can fill out those forms, because you have to turn those into your instructor. And then those are graded. So on top of that, you have to do like Gordon's health assessments, which are super, super long for you to fill out. So luckily, my school only requires us to do one, like paper wise. Other than that, we have to, of course, do it on all our patients. But paper wise, we're only required to submit one for that specific clinical site. So like first day I went in, I got my ID for that clinical site. They took my picture. Then we do like we meet up in the lobby, and then we go in, we put our bags up into the lockers. So we were told to bring locks. And then we'll go and have a meeting, and then we'll go right up to the floor. We'll be told who our patients will be, and then we'll go meet up with the nurse that's taking care of those specific patients. And we find that out by looking at a board, and you'll see, like if you watch Grey's Anatomy, you see like the doctors and the nurses, and you can see these are their patients and these are the room numbers and things like that. And that's kind of what we do at this specific site. So we'll go find our nurse, we'll meet up with them. Like I said, then we'll get report, and then we'll go introduce ourselves. Then we'll go and do our due diligence by looking at the computer. And then once you go back in the room, you can kind of talk to the patient because you're going to be doing your Gordon's assessment, which is long as shit. And then like you're doing your physical assessment and things like that. Then you'll start administering medications if that's due. You'll be getting your vitals, your blood sugars, if they require blood sugars. Basically, you'll be looking at that computer to see what orders are due, what you need to get done, and what you can delegate to your patient care technician and your nursing assistant. And then don't forget that you have to document as things are being done or as soon as things are being done and you're out that room. And of course, you have to be mindful of, not sharing your patient's information, even though your cohort will be there. You have to be mindful of where you're at. So like, say you guys are on lunch and you have a good patient, like a good case, that's very interesting. You have to be mindful not to state that patient's information, and things like that. Any pertinent information that could be used to identify that patient, you have to make sure that you're not expressing that, because that's against HIPAA. That's not adhering to their confidentiality and their privacy, and that's illegal. So you want to do that. You want to be careful about that stuff. So even on here, I have to be very careful about what I say in regards to my patients. Like, I won't give you guys any pertinent information. I may tell you if I see something interesting or something like that, but I can't tell you, who the patient was. And obviously you guys won't know the person anyway, so it doesn't matter. And even if you did, that's none of your business. So yeah, you just have to be mindful for that type of stuff. And then after you're done, you guys meet back up and you have what is it called? A post meeting. So you guys will meet up after clinicals are over, and you guys are, you meet up after clinicals are over, and you guys will have a meeting. You'll discuss if you did see anything interesting. You're actually in like a room that's private. Of course, not giving out the patient's name, but you can talk to your instructor and your cohort because they're there to answer any questions. So like if you see or if you saw something that you feel may be beneficial for the next person in your cohort, you can discuss that at the post meeting, and your instructor can give you any direction or answer any questions or anything like that you had about it, even though they'll be doing that also while you're there. Like if you need their help, it's always good to reach out to them. They're your biggest advocate. Because some people will be mean and not want to help you on the unit because they're like, who are you? You're just a student nurse. But at the end of the day, you're practicing under someone's license as that nurse, or as a nurse, not that nurse, but yeah, so they have to respect that. They have to, do the things that you ask them to do as far as like grabbing the vitals and blood sugar and documenting and things like that. So you will receive a little bit pushback depending on, they're set in their ways, or if they do respect the fact that you're in school to be a student or to be a nurse, and that you're a student nurse and you're practicing under someone's license as that patient's nurse for the time being. And, some people are, respectful of that. They understand that. And then some people, like the ones that are a little older, they have a little bit of pushback, but then that's what your clinical instructor is there for. They'll let them know, hey, this person is practicing under my license. At this time, you're under them, as far as, accepting the orders that they give you and ask you to do, and you have to be responsible and do that because that's your job and this is their position. So never go back and forth. Just let your instructor handle that, because with you being the student, anything you say could be wrong or be deemed to them disrespectful, but because it's the instructor and their license, they know they can't go back and forth with them and they have to do what they say. So just let your instructor handle that stuff. And then, of course, try to stay on top of everything, because Lord knows, on top of having clinicals and having to do care plans and what are those chart thingies? Concept maps and things like that, you still have other classes. So I still have 2 lecture classes, which is pharmacology as well as med-surg 1. And it's crazy, you guys. I started those. I'm on 2nd week of pharmacology and I have a quiz already this Saturday. And then med-surg I started Wednesday and I have a quiz next Tuesday. Next Wednesday. So it looks like for every week, I'll be having a quiz or an exam. Sorry, that's makeup on the back of here. Anyway, I'll be having a quiz or an exam for the next 5.5 weeks in each class. So luckily, 5.5 weeks from now, I'll be officially done with my first semester of nursing school. Yay! Let's get through this because I'm in pharm, guys, and I know that pharm has this big precedence and dark cloud over it. So I've definitely been making sure that I'm studying and staying up on my reading and doing my due diligence and doing as many practice questions as I can. And on top of that stuff, you still have to remember you have HESI case studies and prep use to do. And some days we'll be told not to go into our clinical site and we have to go to skills lab and do like simulations with the high fidelity mannequins. So you have that type of stuff to do as well. So yeah, I did find out that a lot of people that started with me did not pass, so they'll be remediating, which just means they'll be sitting out until next March when the new cohort comes in January. When it's time for them to take their exit finals, that's when the people who failed my cohort or my exit final will be able to go and sit for their final. And if they pass at that time, they can then move on with that cohort, but they're no longer a part of my cohort. So like say, instead of graduating with me in May of 2021, they'll be December of 2021. And if they don't pass that time, then they have to remediate and start from the beginning. So that kind of sucks. It's very hard. And I can say, like, if you guys feel like a test is not fair and that you weren't taught the information, rally your entire cohort, rally the entire thing and go and talk to the deans and the nursing office or whatever, because my cohort, a lot of people failed and we weren't taught a lot of that information. As I'm looking at my pharm book and my med surg book, a lot of that stuff that was on the final, the HESI final, was from med surg and pharmacology, which we did not even go over yet. We're just starting this stuff. So it was unfair. So a lot of people rallied together. Well, the people who failed rallied together, and then they went in and the weight of the final was actually dropped from 30% of the grade to 20% of the grade, as well as they had to stick to, and they went back and stuck to, first semester students, the first test, you're able to get 85% on the medical dosaging exam versus the 90% that the rest of the cohorts have to get. So this next exam, I have to get 90 and above, which I did. So yeah, the people who got like an 85%, they were originally told that they failed, but because we were told we needed an 85% for the first semester, they had to stick to that. So they stuck to that. So those people then passed and they don't have to do those remediations and retake the exam. But people who were already failing with a lower grade in classes and then had that high weight of that final, they still failed, because if your final was super low and your grade was already on the border at like 75% and you needed a really, really high final grade, unfortunately, they still failed. But it's okay because they're still in the program. That's all that matters. Sometimes, you may have to sit out to progress and get a better understanding, because you are dealing with people's lives. And this is very important that you actually know the material. Unfortunately, some of that material we were not taught yet. So it's unfortunate that they have to sit out because of that. But if they already had a low score in the beginning and then the HESI final was just like a topping or icing on the cake, then unfortunately they didn't know the material well enough to go forward even before the final. So even though C's get degrees in nursing school, because it is very hard. So those C's, don't get me wrong, are very, very, very hard to come by. They are. Luckily for me, I got B's. I only failed that one exam, which my grade was still high enough to where it didn't really impact me. So that was a good thing. That was a midterm, y'all. I failed a midterm. So, yeah, I was lucky in that regard. It's just a whole lot of energy drinks and coffee and late nights and headaches that I've been dealing with. Oh, look at my skin. You can't even tell your girl been stressed. Look at me. Okay, sweet C. Can y'all tell I got my eyebrows threaded? Yeah, no fill-ins, but they are threaded to the gods. Threaded to the gods. Yes. Back to what I was saying though. But I still got this, and that's because your girl is eating stuff like this. I got to stop. Always mirror on my face. Ain't like I can really do no makeup for real anyway. But I am gonna do probably like chisel my cheeks a little bit. Maybe do a little bit of eyeshadow just because, we already be so. Oh, that reminds me, I need to be trimming my nails. That's what I need to be doing while I'm sitting here. So hold it. Where is my nail file? Where could it be? Whoa, hold it. Okay, yes. Anyway, I gotta file my nails, they too long. That's annoying. But y'all gonna have to deal with it because my nails have to be cut short. And they do. Look at that stuff, y'all. Like, the first day we walked in here, the clinical instructor looked dead at our nails, looked dead at our socks, looked to make sure we all had our secondhand watches, made sure we had our IDs, badges, made sure our hair was off our collar. Like, that was the first thing. Like, it wasn't no, hi, how are you? May I have your name? It wasn't none of that. It was a look over your uniform real fast, right quick. And when she realized we were all in uniform, we were all up to par, then that's when the introductions came. Like, you know, they be real with it. Like, it was this one girl, I was told, that showed up to clinicals 30 minutes late and had failed the exam anyway, so she wasn't even supposed to be there. So it was just like, girl, what made you show up? But anyway, that's not here nor there. That ain't none of my business or y'all's for that matter. But yeah, that was crazy. I just wanted to share that with y'all. But let me get these nails down while I'm running my mouth. Yeah, I just wanted to come and talk to y'all because I haven't had really time, because I also went back to doing work study. Remember I told y'all I took 3 weeks off. I don't know if I told y'all, but I did. I took 3 weeks off from work study because it was getting real hectic with them checkoffs. Them skill checkoffs were no joke. So I had to stay in the lab the majority of the time, practicing my skills. Them Foley catheters and IVs and medication calculation and medication admin, and you know, knowing all the spots for the injections and things like that. They got a little hectic because my teacher is a really not old nurse, but she's been a nurse for a really long time. That particular instructor, and she's really hard. I don't want to call her anal, but sis is like pressed. Okay, she don't be playing. Like, you can't go out of, you can't miss a step, not miss a step, but you can't like go out of order and go back. Like, sis ain't having it. She ain't playing it. She don't give you no hints. Like, as you doing it, as soon as you mess up, she be like, I'll be seeing you next week. You'll have to redo that, and if you mess it up that time, you'll be remediating. She always says it like, you know, a lot of my students have to remediate, you guys. You know, this is serious. Someone's life is in your hand, which makes sense. But like, come on now, sis. We only been in school for X amount of weeks. But yeah, she wasn't playing it. So sis here had to take her time and get in that lab and practice. I even had to go to some of her office hours because I wanted to make sure I was doing it right. What sense do it make for me to be sitting up practicing if your girl ain't even practicing the way she wanted to be done? So yeah, I went into her office hours a few times, and she was like, yeah, you're doing good. So I made sure I kept practicing because you ain't allowed to have like no study aids, no cheat sheets, no nothing. And homegirl be looking too. So it ain't like nobody in your class can be like making any type of suggestions just to let you know that you messing up or you forgetting something. She don't be playing that. She be watching. And if she catch you, she tell you automatically gotta remediate. She ain't even gonna watch you. You not even gonna be able to do your skill to check off. So the bad thing about check off is you can't miss nothing. Because if you miss, it's automatic unsatisfactory. And if you miss anything, that means you gotta redo it. So yes, it's very hard, it's very demanding, but it's definitely gonna be worth it. Y'all can do it, I can do it, we got this. You know, I'll be tired because of these damn kids, but this is the life that I have, and I'm gonna make do. I'm gonna make these things as short as dang on possible because they grow so fast. Well, anywho, I hope that this was informative. I didn't let you guys know that I had started clinical, so I did, and I think I let y'all know that I passed. Or if I didn't, it was because I had recorded the video, I think, and my phone broke. So, and it was on my phone. So, yeah, I think I lost that footage. So anyway, I'm just updating it now, letting you guys know. I'm actually about to post this while I'm sitting here trying to get ready. I'd like to leave out my house by 2 o'clock. I got 15 minutes to leave out. So, because I got to stop and grab something to eat too. And then my site is, about 40 minutes from here. Go for it. You kind of still see where I had the braids at. Anyway, y'all see my little bun up there, just thrown up there, looking crazy. Yeah, so I probably don't have time to sit up and upload this right now, so I'll probably be uploading this tonight. Oh no, I probably can. Let me just go ahead and end it. So thank y'all for watching. Come back. Make sure that y'all keep coming back, because I got future updates for y'all. I'm gonna let y'all know what's going on with me. Let y'all know how this nursing journey is going. Please update and let me know how yours is going. Drop them comments below. Hit me up in my email at always dot, like the period, dot NYGERIA at gmail.com. That's all lowercase, no space. All right. Thank you. Holla at your girl. Boop.